What is glaucoma treatment? Glaucoma treatment depends on what type of glaucoma that you have. For a child with congenital glaucoma, the treatment would involve performing a special procedure called a trabeculotomy. And this involves using a special instrument to open up the drainage channel in a part of the eye we call the angle of the eye, which is where the fluid collects before it's drained outside the eye. For adults with open angle glaucoma, typically we'll start with drops, and there are about 5 different classes of drops that we can choose from. We would normally start you with one and then titrate the treatment based on your response, your eye's response to the drop. Some patients go up to 4 or even 5 drops, which we call maximum therapy. Now at that point, patients would then need laser surgery or real surgery. Some patients with very severe glaucoma would need laser surgery or eye surgery proper even before they get to the maximum drops stage. Now, the laser surgery involves a procedure called trabeculoplasty, in which we use the laser beam to make micro openings in the angle of the eye, the part of the eye that the fluid collects before it drains outside. So we make multiple openings in there, which allows the fluid to drain more easily. This procedure has superseded its predecessor, which wasn't repeatable. But this one is very repeatable. Another good thing about this treatment is that it's very selective, meaning that it only targets that part of the eye which is involved with drainage and leads to very little scarring. For patients with angle closure glaucoma, we perform what we call an iridotomy, which is making an opening in the iris with a laser. And this has the effect of deepening the eye and allowing the fluid more access to the angle so that it can drain. In more advanced cases, we perform what we call a trabeculectomy, which involves making a one-way drainage valve between the eye and the outside of the eye. So whenever the fluid gets too much, it drains through a one-way channel to the outside of the eye. In more advanced cases, we implant tubes and other devices onto the surface of the eye to assist with draining the fluid.